Hello. I'm Kevin Maney, and I'm going to talk to you about the end of healthcare. In the best of all worlds, healthcare would not exist at all because we all just want to be healthy. And if you think about it, like nobody wants to go to the doctor or take pills or have surgery or any of those kinds of things. And in fact, anybody in the healthcare industry will tell you that it's really a sick care industry. It's really about taking care of you once something happens, which is actually the most expensive and painful and difficult way to take care of you. So what we really need is something different, a new approach to healthcare. And the key to that new approach to healthcare is data. And on the back end of this, what it's going to mean to the people, all of you people in this room. And so as a way to talk about this and to show you what I mean by this new idea of healthcare, I want to walk you through what the new physical would be. Now, a lot of you in this room probably have gone through the typical physical that you go to when the annual physical. And you go to your doctor, and you have the doctor's attention for, if you're lucky, 20 minutes. So the doctor listens to a bunch of things and looks in a bunch of things and maybe takes an EKG and some blood work. And it's really a terrible data collection event because all it's doing is taking one point of data at one moment in time when you happen to be stressed in this doctor's office. And that's all. I mean, and in fact, if the doctor wants to compare that point in time to previous points in time, they have to go get medical records that sometimes are not that available. So oftentimes you're not even having any kinds of trends here at all. It's just this one moment in time. And all the data that they collect is just written down in scribbles, or it goes into an electronic medical record that's not shared with anybody else. So it's actually really a terrible data collection event. What we really want, we have technology that can help us collect data about your health wherever you happen to be. We want to know what your health is like when you're at home. We want to know what your health is doing when you're at play. We want to know what your health is doing when you're at work. And so I want to walk you through something that I've gone through recently as part of the work that I've been doing, but it's also just as a personal. So there's a company here in New York. I don't know if any of you have run across it or heard of it or maybe even use it. It's called Forward. So I recently signed up for Forward to find out what all of this is like. And so one of the first things about Forward, now the reason that healthcare is a sick care system, one reason is because of the way the payment system is set up. It actually rewards the doctor for taking an action, for giving you a shot, for making you come in for an appointment. That's how you make a lot of money in healthcare for the most part. So Forward, for starters, is a subscription. You pay a certain amount of money per month, and you have all-you-can-eat doctor's visits from that. So that automatically twists the model around and says, well, it's more important for them to keep you healthy, because if you are healthy, you're not coming into the doctor's office. You're not using their resources. They actually make more money just by having it be a subscription service if you are healthier and not sick and not come in. But that's only the starting place for what this is like. So you walk into a Forward office, you sign up for them, you start to subscribe, and you go in the first time, and the first thing that the Forward people do is hand you a genetic test. Of course, as we all know, like the price or the cost of a genetic test is dropped by unbelievable factors. So you walk in, and in fact, they give you a 23andMe test for free, or there's another company called Color Genomics that has the more detailed version of your genetic test, more detailed data analysis. Costs all of $185 if you would rather do that one. So this is a beginning of data, because it's this baseline amount of data on you that's never going to change. First thing, get a genetic test. Now we're starting to build data about you. Now there's another thing. When you walk into the forward office and you start your new physical, you go and stand before this body scanner. And the body scanner takes a bunch of your vital signs, your heart rate, your weight, your height. It actually does this entire scan to outline your body, so you get things like body mass index. And again, this is all. Yes, it's this moment in time at this particular moment, but it's the beginning of a database. So all of this starts to go into the forwards database. And by the way, when you go, after you do the body scan, you go into the office and you sit there in the room with a doctor, and there's a giant screen, well, maybe not that big, but it's a giant screen that the doctor has touch screen, and all the data from everything you've done so far pops up on the screen. You can maneuver it around, click through to find more information behind these things. So even the visit with the doctor himself or herself becomes something more like a data exchange. Well, then let's keep piling on here. So once you sign up for Forward, and again, by the way, there's a number of these other subscription kind of companies and that are trying to do some of the same things. Not just one, but Forward was actually started by an ex-Google executive, by the way, so very much of a data mindset going in. And you get an app on your phone. One of the most remarkable things about the app is how many of you have instant access to all of your medical data? Probably none of you. So this has not been part of what we do with our health in the past, but now you go to something like this and you get this app, and everything that's happened, the data they've collected, the conversations you've had with the doctor, everything, the recommendations the doctor says are all in the app. You start to build this in here. You can have access to it anytime. And the app, by the way, also gives you 24/7 access to a doctor or a nurse practitioner. If it's 2 a.m. and you've got a pain in your side and you want to figure out what it is, you can actually contact them through the app. And all of those interactions stay inside of the database and forward in the app. So you always have access to all of that. So now you've got, you've gone in, you've got a genetic base of data, you've got a base from blood work and from the scanner and all these things, and you've got an app where it's all starting to sit. Now, probably a lot of people in this room have some form of way you can track other things about your health all the time. Maybe you're wearing an Apple Watch that has heart rate monitors and all those other kinds of Fitbit sort of functionality to them. Can constantly monitor things and actually send data back to an app. Maybe you've seen a lot of people these days are wearing rings that do much of the same thing. And also we can add in things like sleep. It can track your sleep and track your breathing rate. The one on the bottom right here, it may be a little less well known, but it's a company called Spire. And Spire makes what they call health tags, which are these very tiny little tags that, with the observation that maybe you don't want to strap on a watch every day or put a ring on every day, but if you actually sew these tags into your underwear, you're probably going to wear them every day, unless you actually leave the underwear home. I'm not sure. But we have now all of these different Internet of Things, these IoT devices, that we're starting to wear and starting to track data that also is about our health. Let's add something else on top of that. You may have heard of a company called Lavongo. Lavongo actually had an IPO just a few months ago. And so Lavongo started as a company to help diabetics manage their condition. And the way it works is, so it comes with a wireless glucometer, so you can start to track blood glucose levels. And it also comes with an app and a service behind the app. Now, the idea is to try to help people with diabetes manage their conditions so they stay out of doctors' offices and stay out of emergency rooms, stay out of hospitals. So first of all, it's constantly tracking glucose levels. It's constantly tracking vital signs. like heart rates and sleep and all these other things. But it's also doing something else which is kind of interesting. It's got an AI chatbot sort of feature behind it, and it will ask you questions during the day. We'll say like, just questions about like, how are you feeling right now? Or are you feeling dizzy? Or how did you sleep last night? And these are questions that are designed to start to understand your patterns as an individual. And as it starts to understand your patterns between the glucose levels and vital signs and the questions you're answering, it starts to understand, because every person's diabetes is different from everybody else's, it starts to understand yours so that it can start to predict events. And what will happen is it'll start to see, as these patterns emerge, that, hey, you're about to have some kind of event that's going to land you in the emergency room if you don't do this. Take some action now. And it will send you that message. In fact, if it's severe enough, your phone will actually ring and it'll be somebody, a human on the other end, who's gotten a signal from the AI that there's something wrong here. So add this on top of all those other things. If you have somebody especially has a chronic condition, and by the way, Lavongo started out doing this for diabetes. It's now expanded into other chronic conditions like hypertension, and it's going to keep going down those routes. It wants to become a company to help anybody with a chronic condition manage that condition. But all of this is an enormous amount of data about that thing that dominates your particular health if you have one of these conditions. So layer that on top of everything we've already talked about. Now let's layer something else on there that actually doesn't really usually happen when we talk about our health, and that's our mental health. So there's one company called MineStrong, but there's actually a number of other ones out there that are along these lines. And MineStrong is an app that you would download on your phone, especially helpful for people who have a history of depression or PTSD. And the app on your phone is not actually monitoring your data, your personal data, mining your personal data. What's it doing is watching the way you use your phone, the actions that you take, how you click, how much you type, how fast you type, when you're using your phone. And what the people behind MineStrong have figured out is that these patterns can actually predict whether you're about to go into a depressive or PTSD event. And again, starts to gather all this data, use AI behind it to look for patterns and be able to tell you, hey, something's happening that you need to take care of proactively, rather than doing something where you wind up in an emergency room or worse. So again, another thing, data upon data upon data, and now we've got data about your mental health to add to all of this. Another aspect of health that we just seems to get left out of anything that has to do with doctors and physicians is your fitness routine. And I worked with a company out of Seattle called TraineeAct. There's a number of companies, again, like this, but TraineeAct was one I'm familiar with. So TraineeAct started out as an app that could give you access to a personal trainer. They had a team of personal trainers behind it, and you could use this app to get a training routine from a personal trainer and interact with that person. Not like Peloton where you'd actually have the training session with this person in front of you, but the personal trainer would give you the exercises to do and follow up and ask you if you did them, and have conversations. And you could also enter in, not only would it collect the data about your personal trainer interactions and sessions, but let's say you also, in addition, played soccer for an hour today, or you ran, lifted weights on your own, or something. You can enter all that in here, so it starts to track your fitness. And along the way, it has, it's also tracking your weight variations, your heart rate variations, all these. So basically, the fitness aspect of your health starts to get tracked and added to whatever else we know. So I walked you through a whole bunch of different apps that are separate from each other. There's a missing piece here, and that's if you think about your iPhone. It sits on top of iOS, and it's a platform that allows apps to easily be downloaded and used, but it also allows underneath for certain kinds of data to be shared with each other. The GPS data from your phone can feed into your map applications to tell it where it is. You get an email on your email app that sets up an appointment, and the data can drop in through the system to your calendar and populate your calendar. None of that kind of thing exists when it comes to something like healthcare apps. And of course, when you're talking about healthcare applications, there's an extra level of privacy and being careful with your data and all of that has to happen. And so one of the other things that's going on in the background in the industry is there are a number of companies. There's one particular one that I'm somewhat involved with. It's in a stealth mode, so I can't even tell you what it is. But the idea of these companies is to create a platform for these kinds of apps to exist and be able to share data. Because all of that data that I was just talking about is somewhat useful if it's isolated, but is tremendously useful if it starts to come together and paint an entire picture of you, which is the idea behind this. There is an aspect of all of this, though, that's also in the air as we talk about this kind of healthcare data. It has to belong to you. It can't belong to the hospital system that you go to. It can't belong to each one of those apps that has. If you're going to collect all this data about your own health, we have to have some new kinds of laws and policies that make sure that it belongs to you and you get to decide what to do with it. Now that may have some, I'll leave it to you to understand what kind of effect that has on being able to use it as alternative data, but it is going to be an imperative when it comes to this kind of healthcare data. So then, what ends up happening is if we've got this basic level of genetic data and our data from our interactions with our doctors and data about our chronic diseases and data about our fitness and data about our sleep and data about everything else, our mental health, and it can all come together through some kind of a platform, then we've got an entire picture of your health, and not just when you're in a doctor's office, but every single moment of every single day. And this is where AI starts to become really important, because then the AI can actually watch this and discern patterns and start to become proactive about your health and start to tell you, hey, do this, and you'll get out ahead of this condition that's about to happen, or do this and you'll be healthier. The whole idea of all of this is to use the AI to make us all understand what's going on with our health all the time, and constantly be able to be proactive about it and stay away from doctors and hospitals and pills and needles and surgeries and everything else. Stay out of the sick care system, because nobody wants to be in the sick care system. And so some of the people that I'm working with, and what we're trying to do is redefine this idea of healthcare as what we're calling health assurance. The idea that what we all really want is an assurance that our health is going to be good and to stay as good as possible and to stay out of the healthcare system. There's no question that this is going to require some changes in policy. We don't think that it has anything to do with big bang solutions like Medicare for all or anything that's so enormous. It's a lot of little things that make sure that that the guardrails, there's guardrails around this so that it maintains privacy, it does no harm, all those kinds of things. There's a lot of things, ethical things around AI that are going to have to be discussed. There's going to have to be policy work that goes on behind this, but definitely not these big bang solutions. It doesn't have to be that way, because a lot of this is already happening. It just needs to be allowed to emerge, and it needs to have some of those protections and guardrails around it. And then ultimately, what this means is that there is going to be an unbelievable amount of data that never existed before about the health of every individual. Because what I'm talking about that is just emerging now, like all of us are, adults, and we're going to start doing this maybe sometime in the next few years or 10 years. But imagine the day when a lot of this stuff starts the day somebody is born. This is what's going to happen. I mean, the day somebody is born, the first thing that's going to happen is the doctor's going to take a swab and get a genetic database on the baby. And all of this will start and become a lifetime of data that is going to just inform us about the health of individuals and of populations in ways that we just have never imagined before. Sort of to wrap that up is that I'm working with, right now, part of this is the guy with the beard that I'm standing there with is Hemant Taneja. And Hemant's the managing partner of General Catalyst, one of the big VC firms, very successful VC firm. And I think some of you, I saw some people with the Unscaled book. We wrote that book together. It was out about 18 months ago. And we're working on a new book and a new way of talking about all this health assurance stuff. The other fellow is Steve Klasko, who is the CEO of Jefferson Health in Philadelphia, who was the other partner in this work. And this is a very important part of this. As many of you have seen, Silicon Valley has been throwing health tech companies at the industry for the past 10 years. And they've had very little impact. And part of the reasons they've had very little impact is because those companies tend to think they're going to go in and take the Silicon Valley approach and, break things and ask apologies later and disrupt and all of that. And the healthcare system is too big and complex and too regulated and closed to have that happen. And the healthcare industry, by the way, also tends to try to build technology to do some of these kinds of things, and they do it internally. And what they end up doing is trying to make what they already do more efficient. We don't want to make what they already do more efficient. We want to reinvent the way healthcare is thought about and delivered to everybody. So what we think is absolutely essential is that these two pieces work together. And that's why we're working with the CEO of a healthcare system, the head of a venture capital fund, and I do a lot of my work these days as I call a category designer. I work with companies to help them find new market categories and define them, and then put them into words that make us all understand and capture those categories. So between the three of us, we're really going to try to bring this concept of health assurance to the world and bring this concept of using data and make our lives better to the world. Thank you very much.